Today, I want to present a ceremonial check for over $6.4 million in lead hazard reduction demonstration grant funds to the City of Kansas City and its health department. These funds are part of a broader nationwide announcement by HUD in October of over $420 million. These funds are being awarded to maximize the protection of children from lead poisoning by assisting this community to establish comprehensive programs to identify and control lead-based paint hazards. The work to end childhood lead poisoning begins in our communities. Lead exposure and ingestion has a detrimental effect on children, and it has an effect that affects their future. So by this investment in funds to address these issues now, we make sure that these children have a brighter future. Kansas City has administered over $16 million in lead-related grants since 2018.
Around the end of the year, you always have a chance to think about the accomplishments that you've had over the year past. And although this press conference is here to discuss a great many things, I always want to take the time to celebrate our Kansas City Health Department. They have been in many ways foundational to my entire tenure as mayor. The work you do each day is noticed, it is appreciated, and it is respected. You may not hear that all the time. In recent years, you've been more subject to political debate than perhaps you had been in years past, but you are difference makers for our community, and I'm honored each day to work with each of you. Let's give them a round of applause, baby. So starting next month, we'll get out, we'll create more opportunities to make sure that everyone can be healthier. I think Kansas City is one of the finest communities in the country to live. And the way we make sure that it's a fine community for everyone is to make sure that we're addressing things like long-term toxic exposures that appear in certain homes, making sure that everyone knows their access to programmatic efforts like this one, and making sure, importantly, and this is why the health department is such a key part of city government, making sure that whatever great programs are thought of in Washington or elsewhere have a way to get to families here on the streets of Kansas City. This collaboration is an outstanding example of that.
Childhood lead exposure is one of the most critical public issues of today. And so this is a great honor, and it is with great gratitude that we accept this fund. This is an area in which people have to be trained and they have to become experts at serving our young people. So I'm extremely proud of our team here who has worked hard to not only secure this funding, but to also promote its use throughout our community. And so I want to acknowledge again our federal partners who are well appreciated. I thank you again. And I also want to thank our environmental health services team. Our program has been active since 1997, and we plan to continue in this work for the years to come.